Hello, good afternoon, and thanks for joining us. And today, our topic is what to do about close contacts. So actually, ang topic po natin is help. I'm a close contact. Ayan. Tulungan niyo po ako. Naging close contact po ako. So, I'm Dr. Ana York Bondoc, and ito na po yung aming libreng konsulta. I'm sorry we can't answer all personal questions talaga sa messenger. Sobrang dami po talaga. But we are very willing to have a live po, and you can put your questions below. So we are live po on YouTube, we are live on Facebook, and sige po, let's start na po. Ilagay lang po yung mga tanong. So our question comes from Susan. Dear Doktora, naging close contact po kami because our kasambahay became positive. Please give us advice kasi ang dami-dami pong nag-a-advise sa amin. Natataranta na tuloy ako what to do. I have kids, my husband, and myself. And of course, the kasambahay who became positive. So tulungan niyo po ako, Doktora. So ang ganda, no? Ang dami po talagang mga tao na yung either nakahalubilo po nila ng New Year's or maybe even their kasambahay, their driver, their office mate became positive. So ngayon, na-inform sila na sila po ay isang close contact and what to do. So ito na po yun na makinig kayo mabuti. I think I sent some points. Opo.
Yes po. Letter A, sino ang close contact?
Thanks, Ma'am Reyna. Ma'am Reyna is our nurse, will help us today. So, one of the things na naguguluhan ng mga tao is, sino nga ba close contact? At close contact ka ba? Okay. Kasi nagpapanik lahat, pati yung mga dadaanan na lang po sa daan, close contact na raw sila. Okay. Sa amin po, no, we've been contact tracing for almost 2 years sa aming LGU, and I've also been advising a lot. The first two groups of close contact is yung kasama mo sa bahay. If somebody in your house, like your husband, your kids, nanay mo, kasambahay mo, driver mo, yung talagang looban po ng bahay became positive or nagkaroon po ng simptomas and you suspect talaga na COVID yon, automatic po yung loob ng bahay is close contact. Second, after the house po, is the office. Hindi ho yung buong floors, 13 floors of the building, hindi. The people in the immediate room po of the person who got positive. Halimbawa po, na positive po somebody who works 2 desks away from you, may aircon po, sarado po yung bintana, then you are automatically a close contact of that person. However, kung nasa first floor si Kuya Guard at ikaw ay nasa 10th floor, pero you both work for the same company at na positive po si Kuya Guard at hindi nyo naman ho nadaanan ng duty siya, you are not a close contact. Okay? Ngayon, halimbawa, kasama nyo sa lunchroom, kwentuhan kayo ng kwentuhan doon, sarado yung bintana, na positive yung isa doon, that is a close contact. So the most common po talaga is home and work. And then the third po is yung nakasama po sa isang event. If there was a mass gathering, o huwag na natin sabihin mass gathering, party, kainan, inuman, and somebody there became positive, automatic po, lahat po ng nasa party yun, kasi hindi na natin alam kung saan sila nakupo, kung nagdaanan sila or what, automatic that the entire party becomes close contact. Ngayon, your neighbor became positive. Close contact ka ba? Hindi po. Unless you went to the house of the neighbor and made chika-chika there. Yung nadaanan po, 5 minutes nagbigay ng envelope, nagbayad po. Kung minsan, kahit yung sa tricycle, open air, mahirap pong sabihin, okay? So, yun po. First of all, we need to know what is a close contact. Okay.
Isolate ASAP, letter V.
Ayan, tama yan. What's the first thing to do? Aside from, pagkatapos ka nang sumigaw ng, oh my God, isolate. Okay? So, isolate na talaga lahat ng close contact. Wala nang tanungan, wala nang awayan pa, wala nang insisting that I feel fine. Isolate, period. Wala nang tanungan talaga. Kasi may mga I feel fine, ayoko magpa-isolate. No. Kung kasama nyo po sa bahay, close na kasama sa opisina, at saka po talagang you spend time with that person without a mask, you need to isolate. Okay, stop arguing that you feel well, isolate yourself. Next.
Letter C, test.
Ayan ang magandang tanong. ganito po yun, marami talagang nagkukulit. Oh my God, test, test, test. Ako po, and kami po, and Dr. Edsel Salvania have also said ready to already, testing is not the first step. First of all, isolating. Once you're isolated, then you can think, should you test or should you not test? Okay. First of all, how are you feeling? Kasi pwede na rin ho yung close contacts at mild symptoms, the treatment is the same. Yung sa close contacts po and mild symptoms, it is okay not to test kaagad. Kasi naka-isolate ka ni. Pareho lang yun. Kung positive, yung test, whatever test, kung antigen o PCR, kung positive yon, you have to isolate. Kung negative yon, isolation ka pa rin. Hindi ka lalabas doon, okay? Don't think that if you have a negative test, you can leave. No, you need to isolate pa rin. So, if you're young, wala ka namang sakit, bakunado ka naman, at saka, halimbawa, tumutulo lang yung sipon mo, or maybe sore throat ka, baka nga actually positive ka ni. Pero there is no need to test kaagad. Ano nga gawin mo sa test? Ang dapat mong gawin, isolate and see how you're feeling. Okay? Kung talagang totally asymptomatic, just isolate. Kung mild, isolate. Ngayon, eto, kailan magte-test? Kung talaga pong grabe yung pakiramdam nyo, say everyday na, day 1, walang nangyayari. Day 2, mild symptoms. Day 3, hindi na makahinga. Ay, naku, test na yun and tumawag ng doktor. Also, if you are very elderly, like if you're 90 and above, or 80 and in poor health, or 70 at naka-dialysis, so ganun po, you will really need po to, I would advise po, no, if you're really elderly, you're on dialysis, asthma, heart, sabihin na natin lahat ng sakit, okay? Ang dapat nyo pong gawin is test and call the doctor also. Sabayan na po yun para ma-advise na po kayo if there is anything else that you should do. Pero kung kayo po ay okay lang, basta isolate, yun na po yung tama. And also, practical yun. Reyna, isipin mo yun, paano kung 10 yung na close contact sa loob ng bahay? Who can pay 50,000 naman? Napakahirap.
I'm a fan of isolation. For me, let me just share the experience ko. Ilang times na po na positive yung household namin. What we do, kung sino yung unang may symptoms at merong grabing, katulad po ng sabi niyo, may grabing symptoms, yun po ang pinapatest namin, siya lang po. And then the rest of the family, isolation.
Presume na lang.
Yes. Yung mga wala po nakakaramdam ng symptoms, sama-sama po sila sa isang, kasi hindi naman tayo kalakihan. I mean, some of us only have 1 bedroom, no? So, ganun lang po. And then, once na meron ng symptoms again, hiwalay niyo po siya. And then, observe lang the whole family.
Opo. Ngayon, if you are with your lola is 85, your lola has diabetes, your lola has a heart attack, katakot-takot ang gamot, patest mo na si lola at tumawag ka na sa doktor nyo na na-expose si lola. Kasi likely, magkakaproblema po yun. Okay? So yun po yun kasi testing is so expensive. Number 2 po, it's not readily available, lalo na sa probinsya. And itong isipin mo, if you have to spend 50,000 on the test, and then, na-hospital si lola, wala ka ng pang down payment doon sa ER, o paano yun? So, try to think muna. Though, ang dami nangungulit, magpa-test. Yung iba naman, 5 test na, positive na yung 5, ayaw pa rin magpa-isolate. Kesyo kayo maghahanap pa daw sila ng ika-6 na test. Hindi ganun. If you feel something, if you're a close contact, don't even bother to test. Isolate yourself. And if you test, if you test, okay naman po yung antigen. Pag positive, please, tanggapin nyo na pong positive kayo. Okay? There's really no need to proceed to a PCR. Yung mga tao lang kasi hindi talaga nila, in denial. They don't wanna agree. They don't wanna accept. So, magpipilit sila mag-PCR. And then after that, yung pangalawang PCR, and it will never end. If you never tested, you put yourself in the room, mas lalong mabilis po yun. Eto lang kung negative po yung test nyo, please lang, huwag kayong makipag-away sa barangay na lalabas kayo. Okay? That's not allowed.
Okay. Let's wait for Doktora. Nawalan na po siya ng signal. Ayan, you're back na po, Doktora.
Ayan, sorry. Nagalit siguro yung mga kaaway ng barangay. Okay, guys, sorry. So basically, if you are negative, kasi the reason that I don't like to test is, Reyna, pag negative, likely kasi napakataas ng transmission ngayon, false negative po ang lalabas. Okay? So yung mga yon makikipag-away ngayon sa barangay na negative naman sila. Therefore, may karapatan silang lumabas. Hindi po ganun na. The DOH said, because of the high rate of transmission and the huge possibility of a false negative, kung close contact, you have to stay there pa rin. And then if you're showing mild symptoms, mas lalong you need to stay in your room. Okay? Kaya ayoko talagang testing is the first step. Isolating po talaga is the first step, and assessing the risk po of the patient if they need to be tested kaagad or if they can just be isolated na lang. Okay?
Okay. Letter
I
E.
think we were in letter D.
Letter D. What is the letter D?
How long po yung isolation?
Yes, how long ang isolation, Doktora?
Ayan. Paki-flash na lang po si letter D pag naka-adjust na po, no? Ayan.
How long to isolate?
Ayan. Kung close contact po kayo, no? It is, first of all, kung positive po kayo or with symptoms, okay? 10 days po yan. Negative with symptoms, may simptomas, may nararamdaman. Yun po yung meaning ng symptoms. Ano yung symptoms? Makati lagnat, may sinat, may ubo, tumutulo sipon, nanghihina katawan. Kung negative with symptoms or positive with symptoms, pareho lang po. That is a 10-day isolation. Dati po sa Delta, it was 14 days. Ito po sa Omicron, binabaan po ng DOH to be 10 days. Pero kung ninenervous po kayo doon sa kasambahay nyo, gawin nyo ng 14 days. Okay lang yun. And then, there again, if naman, no symptoms, close contact lang ha, close contact, vaccinated po is 7 days. And non-vax po is 14 days. Okay? So, ito po yung difference, ano? Kung bakunado po kayong close contact, 7 days. Kung hindi po kayong bakunadong close contact, 14 days. Kids, 14 days kasi hindi sila bakunado.
Letter E, pinaka-favorite ng lahat. Don't panic.
Ay, nako talagang yan ang dapat letter A. Dapat ginawa ko na yung letter A kasi hindi na nakakaisip yung mga tao, hindi na nakaabot sa letter A dahil sa kasisigaw or kangawa or may nahimatay, no? So, the most important is do not panic po. Hindi naman po lahat ng close contact magiging positive. Okay? And even if magiging positive pa po kayo or yung mga anak nyo na positive, yung asawa nyo po na positive, marami pa po tayong magagawa. Most of Omicron COVID variant is mild, lalo na po kung bakunado. Okay? Ngayon po, when to be concerned? If you are not vaccinated, if you are isolated but getting worse, kung may edad na po kayo, and if you have many sakits. Sa mga cases po na ganon, immediately call your doctor. But for the regular public po na below 65, malakas naman ang katawan, mild lang ang nararamdaman, kung close contact kayo, relax lang. At kung biglang tumulo yung sipon nyo, relax lang din po. You will get through this. Okay? So sa mga hindi pa po bakunado, areas of concern po talaga ito. So please to get yourself vaccinated kasi po sa mga DOH hospitals, 85% po naman ICU ay hindi po bakunado. Okay? So let's go for the questions.
Letter A, from Miss Ali Bukan. Hi, Doktora. Close contact with symptoms. Not yet tested pa po. Isolate lang po ba? Salamat po. I'm not sure kung symptomatic po or symptomatic.
Kahit
Doktor.
may symptoms, basta bata pa lang, bakunado, relax lang, isolate. Ngayon, kung gusto nyo mag-test, that's your choice. Option lang po yun. Hindi ko naman kayo pipigilan, ano? Remember, test positive, isolate. Test negative, isolate pa rin.
Alright, next po. From Miss Leia Hernandez Macabali. Hello po, magandang araw po, Doktora. Nagka-reaction po sa amin ng Pfizer booster. Nilagnat po at masakit sa buong katawan. Yung iba po, braso lang po ang masakit. Sabihin may katawan or system sa lahat.
Sorry, I didn't get question. Basta sumamaylo
I
ang
think
katawan niya after the Pfizer booster. So what's the question?
sabihin nito mahina ang katawan or immune system namin. Salamat po.
It doesn't mean anything po. Doctors po sometimes say no that people with intense reactions po to a booster shot or to a vaccine kasi the body is reacting to the shot po no kasi may pinasok po diyan whether it's a dead COVID or inactivated or a messenger RNA po. The body is reacting to that and producing antibodies, and that is sometimes what causes the fever. So it actually means that your body po is reacting to the gamot. But or to the vaccine na linagay, no? And producing the proper antibodies. Meron namang nininervyos, wala daw silang naramdaman, baka daw tubig lang yon. Hindi po, no? Sometimes you are also not going to feel anything. Napansin po nila, the younger you are, the more intense po yung inyo pong reaction to a vaccine or a booster. So, wag po mag-alala for the first 24 hours. You can my husband put salompas on his arm. I drank paracetamol and just rest at home. Ngayon po, important ha, kung nag-persist po yung side effects, then biglang tumutulo na po yung sipon nyo, 3 araw na at 4 na kayo, at hindi nagpa-booster yung 3, isolate.
Next, from Miss Ems Doloso Hatap or Chatap. Magandang hapon po sa inyo, Doc. First time ko po sa programa niyo. Tanong ko lang po, anong magandang gamot sa ubo at sipon na madikit? Naglagundi syrup na po kaming mag-asawa. Sana masagot niyo ang tanong ko. Maraming salamat po. God bless.
Hi, ma'am. Thanks for joining us for the first time and hopefully you'll learn something. Again, I hope you and si husband are already isolated. Ngayon, what can you take na mga over-the-counter medicines? Kasi parang flu-like yung symptoms, okay? First of all, paracetamol. So that kung may fever, you can bring it down to normal. Kasi hindi naman po maganda na 38.5, 38.8, o 39 yung lagnat nyo, no? And then after that, you can take, yes, lagundi syrup is okay. That's a form of cough syrup po. There are decongestants po on the market. Some people po nebulize. Yung suob po, pwede rin naman ho. Some people gargle with the throat for povidone iodine or Bactidol, yung mga ganun po, or betadine. So, lahat po yun you can use, okay? Ang importante, sorry, I'm just adjusting, nahulog po kasi yung phone. Ang important po is monitor if you're getting better. Kasi if you're not, your lagnat is 39, yung ubo mo the whole day na, you need to see a doctor, okay?
For Mr. Jimmy Soriaga, yung dapadaan ko lang, doktora, at nagtanong ka lang, 10 second kayo nag-usap. Close contact po ba yun? Yung napadaan lang daw po at nagtanong ka lang daw ng 10 second. Nag-usap
Nakamask po ba kayo?
Yun ang magandang
tanong. Yan ang magandang tanong. If you were wearing a mask, I wouldn't worry about it, lalo na if the encounter occurred outdoors. If you were not wearing a mask, I don't know what to say. Baka problematic. Okay?
From Mr. Noel Marcus Salas, hi, Doktora, fully vaccinated na po ako. Nagka-fever po ako 1 day, then isolated na po ako. 5 days po bang isolation ko? Need po ba antigen or swab? Noel Salas of Olonga po.
You are, assuming you have symptoms, we are presuming po ngayon, and most doctors presume po ngayon, that those symptoms are already a sign of COVID. So yes, thank you for isolating. 10 days po yan. Ngayon, if you want to test, that is your option po naman. I will not stop anybody from testing kung yun ang gusto nyong gawin. Kaya lang po, if you test positive, 10 days po ang isolation. And if you test negative, 10 days rin po ang isolation.
From Miss Maria Teresa Carrera, Doktora, may second dose noong November. Kailan mi pwedeng magpa-booster vaccine?
3 months, ma'am. 3 months po for the regular vaccines and 2 months po for J&J. So last question na po.
Last question from Ms. Dottie
Marami
Roman.
bang questions para...
Hindi po, Doktora. So last question na po tayo.
Okay.
From Ms. Dottie Roman Banares, pareho kaming may symptoms ni Habi. Pwede kami sa isang kama?
Oh, pwede. That's a cute question. Yes, you can stay in the same room po if you have the same symptoms. Wala naman pong problema. Sometimes people like to separate yung may symptoms sa walang symptoms. Though we actually don't know naman kung asymptomatic na rin po yung walang symptoms. But if you're both feeling the same thing, yes, you can stay in the same room. O sige, last na. May isa pa. Sige.
Okay, last question. From Ms. Tess de la Cruz, gandang hapon po. Pwede po bang magpapaksin ng buntis at ano pong vaccine pwede?
Is this pregnant? Yes. Pwede pong magpa-vaccine ng mga buntis. Any vaccine is okay. Usually po, no, they reserve Pfizer for the mga buntis. But it's okay naman. Wala naman pong bawal na bakuna for the pregnant. Second trimester usually. Pero kung sakali pong nabakunahan kayo today, tomorrow you had a positive pregnancy test, nagpapanik po kayo, so syempre first trimester yon. That's okay. Marami pong nabakunahan na first trimester. And they're all right. Yung mga okay lang pong bakunahan sa first trimester or suggested is yung mga frontliner mommies, like yung mga nurse mommies and police mommies, kasi they need to go on the job. And siguro flight stewardess mommies, yung mga ganun po, security guard mommies. Kasi talagang exposed talaga sila. Pero kung sa bahay lang po kayo, then you can be vaccinated on the second trimester. And yes, you need to be vaccinated po kasi even though mild po si Omicron, pag pregnant po kayo, we really want you to be safe. Okay? So to everyone, stay safe.